I'm Ying. This is Crystalline, and that is SQ. Today I will gonna demonstrate about how we use X-ray to diagnose and probably treat pneumonia. Focus on X-ray for lungs, and as you can see here, this is a picture of X-ray of a normal lungs, and our disease today is pneumonia. And pneumonia, this is a lung affecting acute respiratory infection. Your lungs contain of small bags called alveoli. This is content of oxygen for healthy people. But when you have pneumonia, these are lined with pus and fluid. When a person has pneumonia, it will cause some breathing difficulty, and you will have to restrict the amount of oxygen flowing through your lungs. And the disease is caused by a number of species, including bacteria, fungi, and viruses. So pneumonia series can be ranged from moderate to severe for newborn, children, people over 65, and are individuals with weak immune system. Pneumonia can cause serious symptoms.
Now I'll be talking about what is an X-ray. So X-rays are electromagnetic waves that are used to diagnose medical illnesses, and it's also a non-invasive imaging tool, so it doesn't cause any trauma to the body while it's still able to create the X-ray images. The X-rays penetrate soft tissues and is absorbed by the bones. So as you can see in this photo here, it penetrates the soft tissue like the skin. That's why it appears lighter, it appears darker, and then it's absorbed by the bones, so the bones appear white. So now I'll be talking about how X-rays are formed. So X-rays are generated in the vacuum tube, and then this is the cathode over here, and then this is the anode. So the electrons will be released by the cathode, and then there will be a high voltage in the vacuum tube that will cause the electrons to move at a high speed. So when the electrons move at a high speed, they move to hit the anode, and then X-rays will be produced when they hit the target. And now I'll pass on to Nin to talk about the procedure of taking the X-ray.
During the procedure, your body will be positioned between a machine that will provide the X-ray and a plate that will create the image digitally or create an X-ray film. You have two views. The front view you will have hold your arm up and roll your shoulder forward. And for the side view, you will have to turn and place one shoulder on the plate and raise your hand up to your head. And the physician will search for a white spot in the lungs after during the X-ray procedure.
When you identify of an X-ray image, there is several things that you need to care about. Since different colors represents different density, you can see that from these pictures, in this area is black color, which mostly represents as air, and also you can see there is a light gray color, which also represents bone. In this situation, it represents as ribs. And also, if you can see a darker gray color, it represents some soft tissue. And since this picture is showing as a lung, so that this is represent as a heart. As you can see that this picture has different, you can see that it shows that there's a different size of the lung. You can see this side have an opacity and opaque in the left lower lobe of the lung, and this side is like a clearer. So you can see there are several characteristics appears in the X-ray film when having pneumonia. Most of it is you can see there is a loss of outline of the demarcation line and also the claustrophrenic angle. So when you're comparing two different X-rays, one is this picture shows as the normal lung, and this picture shows with the patient with pneumonia. You can see that from this lung, this X-ray film, you can see that both of the lung is very clear and doesn't have any haziness and opacity. While this side, you can see that in this area, you can show that there's haziness and white shadow in the right middle lobe of the lung. So this is where you can identify the differences. So now we are going to talk about the evaluation of using an X-ray to diagnose a disease.
And now I'll be talking about the benefits of using X-rays as a diagnostic tool. So the reasons why we use X-rays is because it's easily accessible, non-invasive, inexpensive, and requires little time. So for example, in an emergency situation, the doctors are able to ask for an X-ray to be taken of the patient relatively quickly, as it does not require much time. And because X-rays are also very easily accessible and can be found in most hospitals, then people are able to take X-rays easily. And then as it's also more common, it's cheaper than other methods of diagnosis, such as CT scans are more expensive than X-rays. So X-rays are considered as a better option because they're cheaper. And because it's non-invasive, there's no prior preparation required. So you don't have to fast or anything before taking an X-ray, so it can also be taken efficiently. And there's minimal trauma and side effects that are done to the body when taking an X-ray. So now we'll move on to the limitations of using X-rays to diagnose pneumonia, and I'll pass the time to Crystal.
So now we are talking about the limitation. The limitation of using an X-ray is lack of accuracy. As you can see that when you're diagnosing a pneumonia and you can see opacity in the chest X-ray, you can see that, for example, lung cancer and pneumonia, when two of the X-ray films appear in front of you, you can see that you can hardly differentiate them by looking at the opacity in the chest X-ray. For example, in the lung cancer and also the pneumonia, you can see that on the left middle lobe of the lung, there is an opacity and white shadow in front of it. And it is really hard to differentiate when it comes up for you in one by one.
In conclusion, X-ray can be used to diagnose pneumonia, as this is the most common way, and people choose it over CT because of its low cost and the speed, and also the accuracy of diagnosis can be improved through tests by doing research, and also there are people say that it is harmful to pregnant and some of other people, but it's not.
This is the end of our presentation.
Thank you.